Welcome to our deep dive into the world of vitamins. You've probably heard about vitamin K, but did you know there's more than one type? Today we're focusing on a lesser-known player of health, vitamin K2. In a study performed at Mount Sinai Hospital in New York, they showed that increased vitamin K2 correlated with increased bone density, and decreased vitamin K2 obviously showed decreased bone density. Another study showed that high vitamin K2 combined with high calcium and high vitamin D led to fewer bone fractures. But if you're missing that vitamin K2, the fractures went up. There are three types of vitamin K: K1, which is phyloquinone, K2, menaquinone, and K3, menadione. K2 is a lot different than vitamin K1 and K3. K2 is more involved in all of the benefits that we're focusing on in this video. Vitamin K1 normally goes to your liver and is involved in blood coagulation. But when there's enough vitamin K1 around, it stays in the bloodstream and moves calcium out of the bloodstream, taking it to places where it's supposed to go, like the bones and the muscles. Because there are places that you don't want calcium. Vitamin K2 usually stays around the bloodstream and doesn't really go to the liver. It also activates another thing called matrix GLA protein. It helps remove calcium from the arteries and other soft tissues like joints, eyes, kidneys, lungs, skin, and breast tissue, bringing it to the bones and teeth and preventing blood clots. It's a calcium transporter. It needs to have vitamin D3 to draw calcium into the bone and bind it inside the bone to make it very strong. And K3 is not commonly used as a dietary supplement or for nutritional purposes. Instead, vitamin K3 is often utilized in animal feed and pet foods. Some people have malabsorption disorders, usually from alcohol and drug abuse, because they are not absorbing enough vitamin K in the liver and gallbladder. Celiac disease and cystic fibrosis can cause a deficiency, and long-term antibiotics can lower the diet intake in the gut bacteria. And you could suffer from cause osteopenia, which means weak bones. Women who just became menopausal have an increased risk of bone loss and a double risk of getting a heart attack. Only if they are deficient in K2, this hypercalcemia can be controlled if there's enough K2 in the diet. But how can you be losing bone, like a calcium deficiency, and at the same time have excess calcium in the arteries? There's been a meta-analysis looking at 12 different studies. Vitamin K1 or vitamin K2 were given. Both of those improved bone mineral density and prevented any hypercalcemia with vitamin D in the participants. Vitamin D3 helps the absorption of calcium in the intestines by a factor of 20 to 40 times. You can absorb a lot more calcium when you have vitamin D in your gut. Vitamin K2 needs vitamin D3 to help mobilize this calcium, because without vitamin D3, vitamin K2 is unable to deliver calcium into the bones. We need vitamin D3 and K2 to control calcium, as well as in many different functions. Vitamin K only stays in our body for 24 hours because it's fat soluble. We have to get vitamin K into our system every 24 hours somehow, every day. There's also a version, MK7 of K2, that comes from bacteria, as in that French cheese, and animal fat. Also found in other fermented things like sauerkraut and a fermented soybean called natto, where they use in Japan. Now, understanding this mechanism, and vitamin K2 is vitally important, since heart attacks are the #1 killer, and if we can keep calcium out of the arteries, that would be very, very good for us. The recommended adequate intake of vitamin K, both from food and other sources, are 120 micrograms per day for a man, and 90 micrograms per day for women. But it is always best to check with your doctor and do a blood test to find your sweet spot. In conclusion, ensuring an adequate intake of both vitamin K2 and vitamin D3 is crucial for maintaining bone health and preventing issues related to calcium regulation. Regular consultation with a healthcare professional is advised to determine individual needs and optimize overall well-being. Thank you for watching. If you found this video helpful or informative, I'd greatly appreciate your support. Please consider liking, commenting, and sharing. Your engagement helps the channel grow and allows me to create more content like this. Thanks again for tuning in, and I'll see you in the next one.